Hello everyone, my name is Dr. Ria. I'm a consultant physiotherapist at CMM, your foot doctor. In today's video, I will be talking about a very interesting foot condition called as the diabetic foot. As we all know, diabetes is a very common lifestyle disorder that we see nowadays. And diabetic foot is just a complication of an uncontrolled level of diabetes. It is basically characterized with a very infectious, ulcerated foot, which happens because there is a lot of destruction of the tissues of the foot. So what happens is, in an uncontrolled diabetes, there is a lot of problems related to nerves and arterial circulation that develop, and it commonly affects the foot region. So because of which there is what we observe is there is a loss of sensation and inadequate oxygen which is supplied to the tissues. So these are some of the reasons why we see infection and ulceration in a diabetic foot. So diabetes has been affecting the quality of life and also the participation socially of the patient gets affected because of the complications that are associated with the disease. So there are various ways in which we can prevent the complications from arising. To list some, I would like to mention. Please, if we maintain a good blood glucose control, we can prevent the onset of diabetic foot. So maintaining a good or a normal range of blood glucose level, getting your foot assessed regularly if you are a known diabetic. Please wear appropriate footwear and also be informed and educated about what a diabetic foot is and how can you prevent it through a medical professional. So these are some ways in which you can prevent the complications from happening in case you are a diabetic patient. Also, there are certain ways in which we can modify the footwear that we wear and help ourselves when we are suffering from diabetic foot. So generally, if we wear a tight and obstructive footwear, it causes sweating, which can predispose the foot to fungal infection. So this should be avoided if you are a known case of diabetes. And ideally, the footwear that you wear should have a wide toe box, a soft cushioned sole, some extra space to accommodate any orthosis if it is required for the patient to wear due to some other condition, and laces and velcro for an appropriate fitting shoe. So also, as we know, diabetic foot has ulceration. So if there is any patient who has developed ulceration or has ulcers either below the front of the foot or around the heel, they should be generally prescribed with an offloading footwear which assists in ulcer healing. So these are some ways in which we can treat and prevent a diabetic foot. So I hope this was informative to understand diabetes and its complication.